start. Pancreatitis is the inflammation of pancreas. We know that in pancreas divided into two parts inside, endocrine and exocrine. Endocrine, it's beta and alpha cells. They secrete insulin and glucagon. And exocrine pancreatic juice, which contains the lipase, phospholipase, alpha amylase, and peptidase, trypsin, and chylotrypsin. This is exocrine. Okay, then pancreatitis is the damage of the mainly it's happened in the exocrine area, but it can also affect endocrine. In general, pancreatitis damage of the tissue of pancreas. Then this is definition. What about the etiology? Usually, etiology multiple could be virus, ecovirus, for example, Coxsackie virus. They can affect pancreas. Alcohol. Could be pancreatitis due to traumas, abdominal trauma, mechanical. Could be also due to diet type of food. It means more fatty food. Food contain multiple fatty food also can affect and lead to pancreatitis. Also could be in this is about exogenous. About endogenous factors, there is one also blood supply disorder of pancreas, blood supply, tumors inside tumor, abdominal or pancreatic tumors. Could be also some adhesions after operation. This is or damage during operation, for example, damage of pancreas. This is about etiology in general. Pathogenesis of pancreas. I forget one more of etiology is the from indigenous is the bile stone usually. Most common is bile stone. In the bile duct or because bile duct and the pancreatic duct they are combined together and into one duct and then to a duodenum. This stone also leads to pancreatitis. Gallbladder stone, bile stone. Then the pathogenesis is the main mechanism of pancreatitis is early activation of pancreatic enzymes inside pancreas. Because normally pancreatic enzymes inside pancreas, they must be non-active. When they become active, when they leave pancreas to the duodenum, inside duodenum they become active. But in this case, in pancreatitis, these enzymes become early activated inside pancreas due to inhibition of inhibitors. That's why these enzymes become digest pancreas. It means that pancreas, he digests itself. Auto-digestion. This is the main mechanism of pathogenesis pancreatitis. About symptoms, there is multiple symptoms. First symptom is pain, abdominal pain surrounding abdominal pain. Other symptom is weight loss. Weight loss, why? It's because of pancreatic juice failure, insufficiency. Then digestive disorder. We know that pancreatic juice digests all substances, fat, carbohydrate, and protein. But there is no pancreatic juice, then digestive failure, then weight loss. Then other symptom, malabsorption. What I said, pancreatic juice loss, then no digestion, then no absorption. Next, weight loss, malabsorption. Then malabsorption leads to next symptom, diarrhea, because malabsorption, food content, it's still in intestine, increase osmotic pressure, then attract water, then diarrhea. The next symptom is diarrhea will contain fat, we call it steatorrhea. also this symptom of pancreatitis. Steatorrhea, fat in stool. Next, we will have these enzymes, what I said, pancreatic enzymes. They become active inside pancreas. They will leave pancreas into blood, not into duodenum, in the blood vessel inside pancreas vessels, then to our blood system. They will digest protein in blood, albumin. It will lead to hypoproteinemia and will lead to decrease oncotic pressure, then edema, usually ascites, abdominal edema. Next symptom is hyperglycemia. Hyperglycemia, sure, why? Because pancreatitis will affect beta cells. Beta cells, no insulin synthesis. No insulin, then hyperglycemia. We can call it second type diabetes. Also, lipase, phospholipase, they can, by blood, they can leave and travel to the lung. And in lung, they will affect surfactant. It will lead to distress syndrome, respiratory distress syndrome. This also has a complication. Then pancreatitis, that's why. Which complication? Other complication. I said distress syndrome, and there is also complication if not treated for pancreatitis, it will lead to pancreatic necrosis. How to treat pancreatitis? Usually by diet, less fat must be in diet, or we, if it's viral, then treat viral infection. But usually it's diet. And in some cases, need for operation. In case of pancreatic necrosis, operation. That's in general about pancreatitis. Thank you very much.